Yeah, so the question was how we kind of start to talk about reducing overtraining that's encouraged by coaches. I think a lot of it is sort of presenting data. So I'm kind of a data-driven physician. I like to be able to bring evidence to that conversation because a lot of times it's mostly when you talk to coaches, they're like, oh, well, you know, this is what they have to do. Much of the kind of conversation about training comes back to like the 10,000 hour rule, which was really created for artistic like performers like piano. And it wasn't, and we've extrapolated it to athletes. And so when they look at it, they're like, well, they have to have this many reps and they have to have this many, and you see it in gymnastics, you see it in ice skating, you see it in a lot of the aesthetic sports, where you see these kids just repeating the same thing over and over and over again. You're like, they can't do it because they're not strong enough to do it. And so what I try to talk with coaches about is it would be better to take that extra day that you want to train them and actually do strength and conditioning with them, with someone who is knowledgeable on how to build strength in these athletes. And this is athletes across the board. And so I think that conversation has been helpful of pivoting that we don't need to do anything that's related to sport that day, but we need to do stuff that's actually helping them be better at their sport on that day instead.
Dr. Wilson, I have a question.
Absolutely.
It's related to the first presentation, and in one of the case scenarios, she presented that if you were to disclose a patient or an athlete's information about a mental health condition to the coach, that might be a violation of confidentiality. As an athletic trainer, I often view the coaches that I work with as primary members of the sports medicine team because they help manage all of the situations. Do you agree with the fact that that would be a violation of the patient's confidentiality? And if so, why would there be a separation between a physical health condition that a coach would normally be made aware of so that they could, you know, act accordingly to their physician's guidance, their athletic trainer's instructions?
Yeah, absolutely. So the question was regarding Dr. Shaba's presentation about stating that when we have an athlete who has a mental health condition that doesn't want to disclose that to the coach, that we as the healthcare team cannot disclose that to the coach without violating FERPA in the school or HIPAA, and that if I agree with that and sort of why is that any different than a medical condition that we would disclose to the coach to kind of help them modify practice or whatever they need to do at that time. So yes, I do agree with that. So here's the thing. So technically, even with a medical condition, so we are not to disclose to the coach. So in the medical world, the coach is not looked at as part of the team, and we can have that whole debate and other things. And even sometimes in some places, the athletic trainer is not viewed as part of the medical team from a physician to an athletic trainer discussing. Now, I would argue that any sports medicine provider would completely disagree with that. But with the whole mental health thing, I've had primary care physicians who have come to me saying that athletic trainers have no business knowing what those athletes are answering those questions to. And I've also had even the national, so the AAP and all the national organizations that do the PPE have actually recently come back and said the entire form for the PPE, for those of you that are athletic trainers, there's a whole history form and everything. That form was never intended to go to the school directly. That literally the reason the signature page is on a page by itself at the end is because that is the only thing that is supposed to go to the school. What I have argued with and what I have actually, like we have talked about a little bit in this state about even being proactive with in our state is actually going to the legislature and having athletic trainers in their scope of practice being added as a medical provider and the medical provider in the school setting. Because once that label is identified, then it's not an issue. So with the coach issue, the problem is that they are not considered part of that medical team. And so even with athletic injuries, I ask the family in clinic, I say, do you want me to let your coach know what's going on in this note I'm sending to school? Or do I just need to write that you have knee pain and that you need to have these modifications done at school? Because if they tell me no, I cannot disclose to the coach. I can definitely disclose to the athletic trainer and I can talk to them about that and we talk about that. But if they do not want the coach to know what's going on, so I have kids sometimes that come in with a possible stress fracture and we're like ruling it out for 2 weeks and they're like, I don't want the coach to know because they're going to give my starting spot away. And if they just know that I can't do anything for a couple weeks and I'm going to possibly be better and I'm going to be back, then it's not an issue. And so there's many times that I just write, they have like leg pain or something generic that the family is okay with. And that's no different than the mental health part of things. And so yes, we cannot technically disclose. And technically if a family, like if a parent found out then and they didn't want the coaching staff to know, you could get in trouble for that.
So just to follow up on that, oftentimes we do speak to our coaches in generic terms. They don't want the diagnosis. They just want to know, are they go, no go, and
yep.
You know, what should and shouldn't we do? would it be appropriate or inappropriate to say, hey, they're receiving health care outside of here, and when that provider clears them, then they'll be back and ready to go? We just kind of keep it general blanket like that?
Absolutely. And that's exactly what I do. And that's what I tell the athletes too, that until you tell me it's okay, this is what we're going to tell them. We're just going to tell them that you have healthcare visits that you need to attend, and that when that medical provider clears you, that you can be at practice fully, we'll get you back to practice. And usually I have not had anyone give pushback on that per se. And so, some coaches will be like, well, is this going to affect them playing? I'm like, no, this is actually going to help them play better. And that's where I leave it, so, which is the truth. So that's usually where I leave it at. So yes, I think that's completely appropriate.
Okay, last question we'll ask is, in the clinic or in the athletic training room, what are some of the signs and symptoms we should be looking for when it comes to RED-S?
All right, so the question was, in the athletic training room or in the clinic, what are some of the symptoms we should look for regarding RED-S? So that's a great question. I didn't talk about RED-S in this presentation. I kind of told you I wasn't going to. But definitely, so Dr. Shaba talked a little bit about it in her presentation. So a lot of times we'll see the changes in, even in mental health, or you'll see that the athlete is very sort of picky or restrictive about what they want to eat. Obviously, if you're just worried about, physique is sort of a last thing. But I think a lot of times they'll be like, oh, I don't eat this or I don't eat that. And so if there's ever, a question that you're concerned, or you just feel like they're underfueled, like they just seem to be getting sick a lot, or they getting hurt more frequently. One of the things I actually had, there was another question that was on there that I'll just touch about because it sort of is related, was just about what we can do as a physical therapist or as an athletic trainer to help us rehab the athlete if we're worried about there's a component of RED-S involved. I think the biggest thing is communicating back with the provider that referred that patient in, and having that provider get them hooked in with nutrition. So we actually have a comprehensive program at our clinic, which has been great. And so a lot of times our physical therapists will reach out to us and be like, hey, I've been talking with the athlete. We've had some discussions. I'm a little bit concerned. They're willing to talk to the nutritionist. And then we just get them hooked in with our sports nutritionist, who does everything virtual. So it's awesome. And so that has really helped. And that has actually helped us get rid of a lot of continued pain from stress fractures or other things. So I think the other thing that you'll sometimes see is an athlete who's just not getting better in the time you would expect them to get better, because that healing and everything is delayed when they're just not fueling their body appropriately. And so just, asking them, a bit even about, you can talk about the differences of hormones and menstrual cycle. And when they're like, oh, I haven't had a menstrual cycle in 3 months, you're like, ding, 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 and so you kind of know. And then talking about, I always couch it with my athletes of, if you don't fuel your body appropriately, we're not trying to make you gain weight. We're trying to make you fuel your body to be able to do the sport you need to do. And when your menstrual cycle turns off, it turns off because your body can't even fuel itself at baseline. And what the menstrual cycle is really geared for is for you one day to be able to grow a little human. Your body knows it can't grow the little human, which means you can't participate in sports either, because you need the same energy to grow the human as you need to do sports. And so until that menstrual cycle restarts, we know that you're underfueling and you're underperforming because you're underfueling. And so a lot of times that helps them understand. But some of them who really have severe disordered eating, they have a whole anxiety and everything else that plays into that. And so really getting them in with people like Dr. Shaba or a mental health counselor to talk about their relationships with food is huge, because you'll never get over that barrier. They know they need to eat, and they're like, I try to eat, but I just can't. I feel really guilty. I feel, and all these other things that happen because they just have this horrible relationship with food.
All right, thank you so much.
Absolutely.